crisis, there is another situation where private hospitals will not be allowed to vaccinate people from the 1st of May. We have with us Dr. S.S. Gill, the COO of CMR of CK Birla Hospitals. If you can just tell us what is the situation and what do you think is the way forward?
So Prema, the situation is that as of now, all the private hospitals are getting vaccination on a daily basis through the government authority. So what happens is there is a portal, we pay up, we are allocated certain number of vials, we collect those vials, and during the course of the day, people come, get vaccinated, whosoever is eligible, and they go back. So that's been going on perfectly fine. Since yesterday we got a notification that with effect from 1st May, now 1st May is an important date here because 18 plus people are going to be allowed that day onwards. We will not be able to procure our vaccine through the government channel, and we will have to directly get in touch with the manufacturers, which is in India's case either the Pune, the Covishield manufacturer or the Covaxin manufacturer. Now that becomes a little complicated for organizations to start individually approaching these manufacturers. Somebody did also, and we were told that it's a 5-month waiting period. So if this particular decision isn't changed and we do not follow what is being currently followed, I am afraid that we might have to stop the vaccination drive, all private hospitals, 1st May onwards, since there will not be any vaccine. So through this channel's medium also, I'd like to appeal to the authorities to let the current model continue. This is a model which is perfectly fine. We are anticipating, or we are actually getting ready for a much larger rush of people 1st May onwards, where if currently we're doing 250, we would rather be doing 500 to 600 every day, provided we are given the access to vaccinations, and that is where we require the government support.
When we spoke last time, you had mentioned that the hospital was equipped to handle the rush after 1st May. If needed, put up a shamiana. It was at the end of the day to reach out to people. Another problem now that will happen is the senior citizens, because we saw the rush in government hospitals as well. What happens then, because there's no social distancing, there is a huge rush. What can be done from the government side?
So you're right, what will happen is, while the number of people who are eligible for vaccinations is going to go up substantially, the number of centers which are dispensing vaccination is going to reduce. So we will be certainly sitting on a problem where you'll see huge queues, rush of people waiting outside government hospitals. So the solution is that the private vaccination centers and hospitals which are gearing up for these vaccination drives 1st onwards should be allowed to continue in the current model. The government should keep on procuring vaccinations for us from the manufacturers at whatever price is agreed upon and decided, because anyways we're going to charge that to the patient, and we will continue to provide the service. As I spoke about the Shamiana, in fact, the auditorium is being readied for this drive, since we were expecting 1st onwards a lot of people to turn up. So that's also put a spanner in our plans as far as this expansion of facilities is concerned.
When we're talking about the beds, it's not just this hospital, but most hospitals in the city have a waiting period. Also, despite satellite centers, there is this problem that is likely to get worse if the cases rise as we are seeing today.
So the problem is certainly going to aggravate. As we speak, we have in CMRI hospital, we have 217 beds out of a total of 345 dedicated to COVID. We have a 30-bed satellite center, and there's a waiting list. So as we spoke the other day also, this waiting list is not going anywhere. And as the number of cases rise, I think we are expecting and anticipating a bigger problem than what we are sitting on today.
A bigger problem in the days to come, and this is something that hospitals want to tackle but are unable to. But it is for the government to come forward, help the hospitals. That is what hospital authorities say. With camera person Khokon Pradhan, Prema Rajaraman, Kolkata for India Today.